Hi everyone, my name is Karina and welcome to UniverseSoul, a channel about psychology and complex human nature. I'm very glad to see you here. Today I would like to talk to you about self-harm. What is self-harm? Why do people do this? Its causes, and whether there is a way out once you started self-harming yourself. I'd like to bring awareness that self-harm is very highly stigmatized. It's not a common topic to discuss in our society, and I think that should improve. We should be more open about this and feel more comfortable discussing this and actually trying to help other people, not judge them. This video will be useful for people who have a history of self-harming behaviors, or for people who know someone who self-harms themselves and you're very confused, you don't really understand what's happening and what to do with it. I really hope that it will become clearer towards the end of this video, so let's dive into it. Self-harm is when a person deliberately damages or injures their body without the intention to commit suicide. Self-harm can be associated with some specific negative experience that happened recently or in the distant past, but that's not always. Sometimes the reason why somebody harms themselves is very vague. Reasons to inflict self-harm can also change over time, and they're not the same for everyone, meaning that there is no specific situation due to which a craving for self-harm will surely arise. Everyone is walking their individual path. Self-harm doesn't imply cuts only, as the majority of people understand it. The manifestations can also involve burns, blows, an obsessive desire to pull out hair on your head or body, or scratch your skin until it bleeds. But it also implies indirect damage, not so obvious in the beginning. For example, alcohol and drug abuse is also a self-harm. Refusal to eat or drink water, or the opposite, binge eating, jumping from a height, and even deliberate intention to be bitten by bugs or animals. Sometimes it's very difficult to notice that someone is hurting themselves, because often self-harm is done while being alone, without witnesses. And it's usually hidden from a family, friends, either out of shame and fear, or because of person's own lack of understanding what exactly is happening. If you feel purely intuitively that one of your loved ones is capable of this, pay attention to fresh cuts or scrapes, bite marks or burns. They can be a warning sign, especially if they occur quite often. Other physical signs can include scars, bruising, and receding hairline. Less obvious signs may include a person who seems particularly prone to accidents or wears long sleeves or long trousers, even in hot weather. But why do people do this? Those who self-injure, they may feel that it helps them to release feelings of anxiety, anger, or sadness. Self-harming behaviors are often rooted in early childhood trauma, including physical, emotional, or sexual abuse or neglect. But again, this is not the golden rule, and it can often be a collection of many different factors that make people turn to self-harm. For instance, bullying, pressure at school or at work, dysfunctional family dynamics, arguments, divorces, relationship problems, cheating, money problems or debts, low self-esteem, dealing with stress, anxiety or depression, confusion regarding sexual orientation or rejection by family or society based on person's sexual preferences. It can be bereavement grief, physical or sexual abuse in adulthood, criminal career and ties to the justice system, and as the result, imprisonment and aggressive prison environment. According to surveys, the most common cause of self-harm is an attempt to cope with negative emotions. Also, the need to punish yourself for something. Polls, they also shatter the common myth that self-harm is an attention-seeking behavior. Most self-harmers, they rarely cite this reason. The problem with self-harm is that it only helps for a short period of time and usually masks the core problem, which sits much deeper in person's soul. Self-harm most often occurs in adolescents and young people. Adults too can harm themselves, especially if they have a history of mental health problems. Self-harm is more common in women, but some experts argue that self-harm behaviors among men can be disguised as addictions or participation in fights, gangs, or the desire to climb high buildings or bridges without the safety gear, or just even loving speed, motorbikes and fast driving. In other words, deliberate participation in dangerous situations. Does self-harm cause physical pain to those who do it? Well, the short answer is yes, but recent neurobiological evidence suggests that those who harm themselves, they have a higher pain threshold. In addition, rather than reacting negatively to physical pain, it actually tends to calm them. They tolerate physical pain better than most people, but they have high levels of emotional reactivity. They react to negative emotions such as fear, anger, shame, or guilt more strongly than those who don't self-harm. Self-harm is not an attempt to commit suicide. It's rather an attempt to stay alive, to overcome emotional pain, and therefore continue living. But if a person has a history of suicidal behavior, meaning that they actually took a step further in the past and almost died, self-harm is an alarming signal. The risk group includes those whose number of episodes of self-harm is more than 20. They have constant conflicts with loved ones. They experience psychological trauma in the past, and they have a number of mental health problems, such as depression, bipolar disorder, or post-traumatic stress disorder. But these are not the main three ones, it's just an example. How can you help yourself to avoid self-harming urges? When you have a strong urge to hurt yourself, it can be hard to imagine doing anything else to calm yourself down. But there are steps that can help you make other choices over time towards your health. Understanding your self-harm pattern can help you understand what makes you want to harm yourself in the first place and recognize when this desire arises. Remember that even if you can't resist the urge to self-harm right now, it's helpful to think about exactly what happened and why after your episode. This will help you understand yourself better the next time you have similar feelings. Learn to recognize your triggers. Triggers are what motivates you to hurt yourself. These can be people, situations, anniversaries, sensations, specific thoughts or feelings. Practice noting what exactly happened just before you hurt yourself. Did you have any particular thoughts? Or did the situation, person, or object reminded you of something difficult? Urges can include physical and mental sensations, such as rapid heart rate or feeling very heavy mentally, intense emotions such as sadness or anger, disconnection from yourself or reality, maybe uncontrollable repetitive thoughts about hurting yourself and how it will bring you release or even pleasure. Possibly you follow a pattern of unhealthy decisions, such as working too hard to avoid your feelings and burying them even deeper in your subconscious. Being aware of your triggers can help you gradually reduce and stop self-harm. Try writing down what you notice about your urges so that you can identify them quicker each time they crop up. Also identify what distracts you from self-harm. Distracting yourself from the urge to self-harm is a way to give yourself more breathing space and reduce intensity of the urge. This can be done when you feel the craving or as soon as you realize that you're hurting yourself. Different distractions, they work for different people, and the same distraction won't necessarily work for you every time. For example, distracting yourself from anger is very different from distracting yourself from fear. So it's important that you have several different strategies to choose from. Try to make your own list of distractions that you have found helpful in the past or that you would like to try in the future. If you feel angry or frustrated, you can play sports, hit a pillow or break the old unwanted furniture. You can scream or dance or rip your old clothes into hundreds of pieces. But again, expressing anger physically or by yelling won't work for everyone and can actually heighten your feelings. So try to do what has a positive effect on you. If you feel sad or fearful, wrap yourself in a blanket, spend some time with animals, walk in nature, allow yourself to cry or sleep, listen to soothing music, tell someone how you feel. If you feel the need to control everything, write a letter to yourself in which you share your reasons for your perfectionism and what will happen if you don't achieve the desired outcome. Does it really mean that the world will be crashing down? You can work in your garden if you have one, or plant beautiful flowers and dedicate your time and control to caring for them. You can also meditate. If you feel numb, touch ice cubes, smell something with a strong, pleasant aroma, or take a cold shower. If you feel ashamed, stop spending time with those who mistreat you and doesn't accept you. If you have stumbled or made a serious mistake, accept that no one is perfect. It's part of being a human. Remind yourself that there were surely some specific reasons for your behavior, not because you're a bad person. If you feel self-loathing and want to punish yourself, again write a letter from the part of you that feels self-hatred, and then write back with as much compassion and self-acceptance as possible. Also find creative ways to express self-loathing through music, songwriting, poetry, painting, dancing, playing a musical instrument, exercise like running or going to the gym to express that anger directed at yourself. But again, all this is just the elimination of your symptoms, and this is only a small part of your healing. Self-harm means working with your inner child, with your pure, innocent energy. When you practice self-harm, it's as if you are cutting your inner child. You turn your higher self into a dirty mixture of fears and pain, where there is no place for your potential to unfold. I believe that we're all born to achieve full abundance, and self-harm is not a part of what you can really do with your life. Self-harm is a feeling of complete loneliness, but you are not alone. Firstly, you have my channel, and you are welcome to share your stories and experiences in the comments below. You can also write to me personally on Instagram if you don't want to be too public. And secondly, the whole universe is behind you. As soon as you believe that the universe is on your side and not against you, that this world really needs you, self-harm will become a thing of the past. Let yourself become aware of this. Take care of yourself. I wish you a fantastic day, and I see you soon. Bye.